Welcome to the 2020 CEO Summit Address and Awards presentation. Thank you to Chamberlain University for sponsoring this session. Please welcome National League for Nursing CEO, Dr. Beverly Malone.
Master of Teaching, Art of Leadership. Colleagues, when the National League for Nursing chose this as our theme for this year's summit, we could not have imagined how important that would end up being as we deal with a world radically altered by the COVID-19 pandemic. Our gathering may be virtual, but our call to serve as masters of teaching and practice the art of leadership couldn't be more real, as are the challenges to nursing education and the tasks before us. I am confident that we are all more than capable of facing those challenges and overcoming them together. Our gathering may be virtual, but our call to serve as masters of teaching and practice the art of leadership couldn't be more real, as are the challenges to nursing education and the task before us. I am confident that we are all more than capable of facing those challenges and overcoming them together. One outstanding challenge is virtual learning, which had become increasingly common even pre-pandemic. COVID-19 has simply accelerated that shift. So this represents a new challenge for us to master as educators and teachers, since virtual learning is here to stay. First of all, no one should give up on the relationship between the nurse and the patient. We know that there are several levels to patient care and that they do not all require in-person learning. In the wake of this pandemic, I believe that most healthcare education programs will have to adopt a hybrid model that relies on virtual education combined with in-person classes, like programs from Frontier Nursing University, Galen College, Chamberlain University, University of Texas at Arlington, and Western Governors University. Virtual learning may also benefit students in the area of telehealth. An increase in virtual learning will help students prepare to support their future patients through telehealth visits and help them be more comfortable during the virtual interview process and diagnosis. It may keep older adults at home or in nursing home care settings, rather than the frequently difficult transition to hospitals. Virtual learning widens the pool for preceptors in remote locations across the nation and around the world, without the limitations of geography. Compatible matching of students and preceptors is more easily facilitated. Hands-on, in-person learning opportunities have likewise been expanded or altered under current conditions. In the past, practicums focused primarily on hospital care, but now, with teaching hospitals cutting back on clinical practicum programs, students may find placements in other settings that are experiencing an increase in the need for preventative or long-term chronic care. For example, students may work under the guidance of experienced mentors in nursing homes or learn preventative care in community outpatient clinics. These types of live educational experiences can also help close the gaps in care that have been documented throughout underserved communities. The NLN has led the way in the study of how the social determinants of health the conditions in which people live and work each day can impact their health. We know that people frequently from diverse backgrounds without a stable income and who struggle to afford housing, endure unsafe working conditions, and lack access to healthcare are the most vulnerable during a pandemic. We should seize opportunities for more holistic learning when we reach out to the larger, more diverse community, rather than focusing primarily on those who have been hospitalized. These communities have been there all along. Therefore, highlighting low-risk community health care in our curriculum and instruction has the added advantage of educating aspiring healthcare workers about health and racial disparities. And speaking of underserved communities, voices for change and support for our communities have been even louder this year, especially among young people. Nursing students are looking to us for guidance on these issues and how they relate to healthcare, which is why it is so important for each of us to demonstrate our own art of leadership. I believe I can confidently state on behalf of the NLN that our membership stands behind those affected by social and economic injustice and the inequities arising from the criminal justice system. We feel and acknowledge the outrage of our fellow citizens at the murder of George Floyd, a Black man, not at the hands, but under the knee of a policeman in his community. We also know that George Floyd is not the only example of people of color who have died at the hands of those sworn to protect the public. While this does not describe the majority of our community of police officers in any way, it happens too frequently, especially in communities of color. His death sparked cries of outrage and weeks of protest in cities, small towns, and rural villages across America and around the world, some still ongoing. We believe that everyone, regardless of their station in life or color of their skin, should be free to breathe and not feel afraid of gun violence or the threat of police brutality within their own neighborhoods or homes. Thus, we speak loudly and clearly in support of those who rally and march peacefully in our streets, raising their voices for change. Colleagues, those voices will also carry over into the classroom, whether in person or virtually, as there is a greater awareness of inequities in all systems, healthcare as well as law enforcement and education. More and more people are no longer willing to accept things as it is what it is. Nursing students will look to you as leaders to continue the conversation on the inequities in our country, in the world, and among us, within the communities of nursing, nursing education, and healthcare professionals. Students will have questions about equity and oppression, and they will challenge our assumptions. How we respond will make all the difference in the development of their lives and their careers. We want the ability to engage students in dialogue that is important, but also respectful. I hope that as you discuss these issues going forward, you will look to the NLN for support. Remember that our definition of diversity, one of the NLN's core values, concludes with these words: differences affect innovation. So we must work to understand both ourselves and one another. And by acknowledging the legitimacy of all of us, we move beyond tolerance to celebrating the richness that differences bring forth. I am sure you will want to use the NLN Diversity and Inclusion Toolkit at nln.org as you work to heal wounds and develop a culture of inclusivity on your campus. The NLN has many resources and educational events that can help you develop your art of leadership as we move forward together in our new shared reality. As Martin Luther King Jr. said, we may all have come over in different boats, but we're all in the same boat now. Still, even with these challenges, amazing and previously unthinkable innovations are being made to nursing education. As we look to the future and seek out new best practices for teaching and learning, let us pledge to base our teaching practices on evidence and work together toward goal number 4 of the NLN strategic plan, advancement of the science of nursing education through the promotion of research that generates evidence about nursing education and the scholarship of teaching. COVID-19 has prompted us to reconsider anew the strategies we use for teaching and learning. Take advantage of this disruption, colleagues, and let it be a creative disruption to innovate and establish better healthcare education that can lead to better patient outcomes for all. You know, in this year of the nurse and midwife, I can't help thinking about how nurses have always taken on leadership roles in times of crises. Think about Florence Nightingale, whose 200th birthday is this year, and Mary Seacole during the Crimean War and the conditions they had to face. How cholera, typhus, dysentery, and other illnesses were taking the lives of so many of the soldiers in their care. Yet they never gave up. Neither have our frontline nurses given up. Every nurse I know has not given up. We don't give up. Our patients are too precious for us to stop. So many other nurses built on Florence Nightingale's example as leaders for their times. Think of Clara Barton and her post-Civil War role as the founder of the American Red Cross. And Lilienwald, who deplored the conditions she saw among immigrants on the Lower East Side of New York, which led her to found the Henry Street Settlement. And of course, think of Isabel Hampton Robb and her fellow superintendents of the new training schools for nursing, who founded the organization that would become the National League for Nursing in 1893. Nursing has a rich history full of leaders who stepped up to meet the unique challenges of the times in which they lived. And it is still a great honor to know that nursing is the most trusted profession in the United States. Every day in the news, we see online and on television the stories of nursing heroes. Nurses, one after the other, tell of how sad they feel when their patients are hospitalized alone, and how they help them communicate with family members through the internet so they know how much they are loved. Their stories are heartbreaking. But then we witness the joy of nurses and other members of the healthcare team when they escort recovered patients through hospital corridors and clap as they leave to return home to family and friends. The caring that these nurse professionals and leaders have shown, their diversity, integrity, and excellence on vivid display, will remain forever alive in our memories. Colleagues, I hope you will take part, if you haven't already, in the NLN celebration of the Year of the Nurse and the Midwife. Please go to yearofthenurse.org today. We are using this celebration for a far-reaching public service campaign that highlights the role and value of nurses and nurse educators in the nation's healthcare system. We have used established media, print, online, radio, and television, as well as social media, to target the general public, as well as public officials and federal agencies, to highlight the critical role of us as nurse educators in building a strong and diverse nursing workforce to advance the health of the nation and the global community. At yearofthenurse.org, you will find special downloadable graphics and an invitation to join with us in our campaign to promote nursing and nursing education. We also ask that you take the NLN Leadership Pledge and commit to act as a positive mentor, coach, and role model to your students, and to maintain and elevate the standards of nursing education. This is also the perfect time to honor a nurse or leave a legacy with a donation to the NLN Foundation for Nursing Education. Whatever you choose to do, I hope you find our Year of the Nurse campaign as exciting as we do. Finally, it is the election year. My goodness, election year. And I urge you to get out and vote. For whomever you cast your vote is a personal choice. But it is important that each of us as citizens exercise our right to vote. People all over the world have been denied this right, have fought and bled and been beaten for this right. Just like John Lewis, the courageous American leader who passed away just a few weeks ago. Let us follow his example and those of others like him to make loud and clear that we are voting this year, regardless of any obstacles that may be placed in our way. With that said, colleagues, please do your part for everyone's health, including your own, and continue to wash your hands according to the CDC guidelines, wear a mask when you are out and about, and maintain social distancing for as long as needed. I wish you, your friends, and colleagues, and your families all the very best. As we look forward, we must become masters of teaching, to practice the art of leadership. The NLN brings caring, integrity, diversity, and inclusion, and excellence. As you know, excellence is co-creating and implementing transformative strategies with daring ingenuity. We join those people that we serve from cradle to grave in teaching our students to provide unswerving care, and we are honored to serve. As faculty, we are the teachers. We are the leaders. We are the pathfinders, and we bring our students with us. Thank you very much. Thank you for joining us for the NLN Virtual Education Summit this year. And thank you to Chamberlain University for their generous sponsorship of this session. We now move to the presentation of the 2020 NLN Nursing Education Research Grants Awards, the NLN Foundation Scholarships, the NLN Home Instead Scholarships, and the NLN Constituent League Award. Let me turn this over to Larry Slater, a member of the NLN's Nursing Education Research Review Panel. Larry.
Thank you so much, Bev, for offering those words and for passing this along to me as I get to start this exciting portion of our awards. As you all know, it is an NLN goal to advance the science of nursing education by promoting evidence-based nursing education research and the scholarship of teaching. One of the most visible ways we meet this goal is through our Research Grants Program, an initiative of the NLN Chamberlain University Center for the Advancement of the Science of Nursing Education. The grant awards are funded by the NLN and the NLN Foundation for Nursing Education. Over the past 20 years, the NLN Research Grants Program has funded more than 120 individual research projects, distributing approximately $1.25 million in research awards. We are indeed proud of the accomplishments of our previous awardees, and we look forward to the innovative research that the recipients of today will conduct. We will now present awards that support 2 outstanding research projects and 3 doctoral dissertation awards. But first, on behalf of the NLN, I would like to thank the members of the Nursing Education Research Review Panel and the NLN members who served as grant proposal reviewers this year. Now it is my honor to present the 2020 NLN Research in Nursing Education Grant recipients. Dr. Jerry Altmiller of the College of New Jersey has received the Dorothy Otto Research Award for her project titled National Study of Quality, Safety, and Just Culture in Pre-Licensure Nursing Education.
Thank you. I'm honored to be the recipient of the Dorothy Otto Research Award. I've always wanted to study quality and safety and just culture from the student perspective so that we as educators can know how to prepare them best for practice. I'm grateful to the NLN for supporting this work.
Congratulations, Dr. Altmiller. And we are most grateful for Dr. Otto's generosity. Dr. Otto was a pioneer in nursing education who led with her heart. She was a compassionate and unselfish leader who gave generously of her time, talents, and money to advance nursing education research. Dr. Otto was a strong supporter of the NLN Grants Program and met with the review panel annually to offer her expertise and words of wisdom. Her presence was definitely missed at this year's grant review meeting. Dr. Otto will continue to be honored with this grant named after her and her generous gift to the NLN Foundation. The next award is presented to Drs. Kelly Powers, Jamie Brandon, and Colette Townsend Chambers of the University of North Carolina Charlotte School of Nursing, who are receiving the NLN Foundation for Nursing Education Award. Their study is titled Teaming Up for Community Health, Mixed Method Study of an Innovative Interprofessional Simulation Intervention. Congratulations to Drs. Powers, Brandon, and Townsend Chambers. Ginger Schroers of Loyola University is the principal investigator for the research project Realistic Interruptions During Simulated Medication Administration and Examination of Errors and Interruption Management Strategies. She is the recipient of the Marianne Rizzolo Doctoral Research Award, which is awarded for a dissertation or DNP project with the focus on simulation. Funds for this award are made possible from a gift from Dr. Marianne Rizzolo. Congratulations to Ginger for receiving this year's award. Ginger was also selected to participate in the 2019-2020 cohort of the NLN Jonas Nurse Scholars Program. Well done. Next, it is my pleasure to present the co-sponsored research grants for 2020. The first is for Kristen McLaughlin of Drexel University, a doctoral candidate at Widener University who has received the NLN Eastern Nursing Research Society Doctoral Research Award. Her study is titled Development and Initial Validation of an Instrument Measuring Role-Specific Knowledge in Academic Nurse Educators. We are most grateful for the partnership with the Eastern Nursing Research Society, who joined with the NLN to advance the science of nursing education. Congratulations, Kristen. Our final research award has been made possible through a collaborative partnership with SNRS, the Southern Nursing Research Society, which goes to Dr. Candace Overholzer from the College of Coastal Georgia, who recently received her doctorate from the University of West Georgia. Her study is titled Seamless Academic Progression for Associate Degree Nursing Students. We are grateful to SNRS for joining with the NLN to support this award. Congratulations, Dr. Overholser. And once again, congratulations to all these outstanding NLN Research Grant recipients. I am now happy to continue with our Best Article Awards. Last year, the editorial board for the NLN Research Journal Nursing Education Perspective instituted a Best Article Award for the 3 categories of articles published during the previous year: primary research article, research brief, and innovation center article. Here are the Best Article winners for articles published in 2019. For the primary research article category, congratulations to Tamara McKinnon, Angela McNeilis, Kathleen De Leon, Melinda Whitlow, and Joyce Fitzpatrick for their article, Current State of International Clinical Experiences in U.S. Pre-Licensure Nursing Programs, in the September-October issue.
Well, thank you so much for honoring our team with this wonderful award. My name is Dr. Tamara McKinnon. We would like to thank the NLN, Nursing Education Perspectives, and the National Council of State Boards of Nursing who funded our research. I'd like to introduce our team, and each of our team members has a little something to say about the work that we did on the article, Current State of International Clinical Experiences in U.S. Pre-Licensure Nursing Programs. Our team members include Dr. Joyce Fitzpatrick, Dr. Angela McNeilis, PhD candidate Kathleen De Leon, and Dr. Melinda Whitlow. Dr. Joyce Fitzpatrick will share with you a few words.
Thank you, Dr. McKinnon, and thanks to our team for such a great journal article. I wanted to speak just a bit about why we did this. As you all know, this is important that we pay attention to social justice in teaching our nursing students. And we believed in launching this study that one of the best ways for our students was to have international experiences so that they could better understand not only what was happening in the world of nursing and healthcare, but also within themselves. So they could learn about themselves and they can learn about what was happening in healthcare delivery in the world.
Thank you very much, Melinda. And you'll have to take yourself off mute. Yeah, thank you.
A great strength was our teamwork and commonalities to disseminate information when collaborating within different parts of the country. Our passion with our diverse backgrounds allowed us to work together to create this manuscript that speaks towards international clinical experiences, and hopefully it could be disseminated and journalized to all nursing programs.
Thank you, Melinda. And Kathleen?
Throughout this project, our team worked with clear, honest communication. And though we came from different places, we used our common interests in this topic to move forward as one.
Thank you, Kathleen. And finally, Angie.
And I would just add that I think our team was successful because we had a deep understanding of each other's strengths and we leveraged those to accomplish our goal. So thank you so much for this award.
For the Innovation Center category, congratulations to Sharon Combe and Deloise Lavrance for a nursing partnership to accelerate academic progression, published in the January-February issue. And finally, for the Research Briefs category, congratulations to Karen Ippolito for her submission, Cognitive Development, the Scaffold for Critical Thought, published in the July-August issue. Congratulations to all of these award recipients. Now it is my distinct honor to present the 2020 NLN Foundation for Nursing Education Scholarships. Each year, the NLN Foundation offers scholarships of up to $8,000 to nurses pursuing advanced degrees to advance their careers as full-time nurse educators. In alignment with the NLN core values and mission, the NLN Foundation encourages more experienced and ethically diverse nurses to pursue advanced degrees to prepare for full-time positions as nurse educators. Applicants are from accredited programs who have completed at least 1 year of their academic studies. The NLN is proud to be the only nursing member organization that provides scholarships specifically to nurse educators at all levels. This year, the NLN Foundation is pleased to recognize 12 outstanding scholarship recipients. They are Jade Chapman, University of Louisville. Karen Hand, Indiana University of Pennsylvania. Melissa Leeson, Villanova University. Melissa McCoy, West Virginia University. Kara Palmer, Michigan State University. Corey Plesko, Johns Hopkins University. Bruno Sacconi, University of Pennsylvania. Robin Schaefer, Vanderbilt University. Yung Kwan Song, University of Illinois at Chicago. Kimberly Walker, University of Wisconsin-Milwaukee. Kelly Watson Huffer, Indiana University of Pennsylvania. And Patricia West, Michigan State University. Congratulations again to our NLN Foundation Scholarship recipients. We are confident that their work will make a major impact on nursing education. For the third year in a row, the NLN Foundation has partnered with Home Instead Senior Care to foster and promote geriatric education through a $10,000 scholarship fund for nursing students. These scholarships are known as the NLN Home Instead Scholarship Awards. We are pleased to announce that 6 scholarship winners were selected to prepare a competent nursing workforce to deliver the best care to older adults. They are Kristen Lopatka, Thomas Jefferson University. Nicole Liberto, Misericordia University. Elizabeth Meyer, University of North Carolina, Chapel Hill. Nancy Parma, University of Texas at Arlington. Kristen Roberts, Utah Valley University. And Jennifer Schoenfeld, University of Texas at Arlington. Congratulations again to all of our scholarship recipients. And we are most grateful to all those members, the 2020 Centers of Excellence, and NLN Academy inductees and partners who donated to the NLN Foundation in the past year and made these awards possible. This year, the NLN was able to help 18 students, up 3 from last year. Our goal is to continue to increase the number of awards each year. We also thank Dr. Cole Edmondson for your leadership on behalf of the NLN Foundation and the NLN. And there is one more exciting award, the Constituent League Excellence in Innovation Award, which recognizes a league that has successfully implemented 1 or more innovations to support the NLN's mission and goals. Receiving the award this year is the New Jersey League for Nursing. In addition to offering excellent programming opportunities to their members, the New Jersey League has expanded their grants and scholarships program to include 25 students at all levels of their education spectrum, receiving up to $1,000 each, and a single recipient pursuing an advanced degree with the intent of joining the New Jersey nursing workforce with a $10,000 scholarship. These efforts are making a significant difference in both recognition of and support for nursing and nurse educators in New Jersey. Again, congratulations to the New Jersey League for Nursing for this award.
I want to thank you on behalf of President Pat Yoder-Wise, myself, and the NLN, and a big congratulations to all of our grant and award recipients. Colleagues, next on our schedule, we have open time, starting at 12:30 for the virtual exhibit hall, poster viewing, and networking in the lounge. So don't forget to visit them again online. From 2 to 2:45, you can access the fourth set of concurrent sessions, followed by another networking break at 2:45. At 3:15, we will hold our annual meeting with a few new surprises this year, as well as a look ahead at how nursing education is changing in response to the COVID-19 pandemic. The day ends with more virtual exhibits, poster viewing, and networking starting at 4:15 p.m. Eastern Standard Time, don't forget. Also, don't forget, if you haven't done so already, please download the NLN Summit mobile app. Just search for the NLN Summit in the Apple Store or Google Play. You can enter our drawing to win one of 3 Amazon gift cards by playing the app game. Another great big thank you to our colleagues at Chamberlain University for your generous support of the 2020 Summit. We hope all of you have a wonderful afternoon. Thank you so very much.